About 1.9 million children from the ages of 5 to 11 have been diagnosed with COVID-19. And the good news is that this population is now eligible for the vaccine, and they are already lining up for their shots. Lindsay Thies in San Francisco tells us how this vaccine rollout is unique. Good morning.
Hey, good morning, y'all, from San Francisco. So this is another busy day up ahead when you're talking about this rollout for kids' vaccines. Second full day, we'll be seeing shots going into arms for those 5 to 11-year-olds across the country.
Ready? Yeah.
5 to 11-year-olds can now get a COVID shot.
Great job!
Among the first, 7-year-old Kyvante Jordan.
All I felt was a little pain.
Now I can sleep, not worry about him going to school and, being exposed to the coronavirus could really affect him and mess him up.
15 million doses of kids' vaccines are arriving at thousands of sites across the country over the next week. The White House is promising enough supply to protect the nation's 28 million children ages 5 to 11. Doctors' offices, children's hospitals, and small clinics started ordering doses last week.
We don't have vaccine yet. We're eagerly awaiting our shipment.
So today's the first day we've been giving this vaccine, and our phones are ringing off the hook.
This rollout will look different than the mass vaccination sites we saw in February and March with adults.
Yay, cool! It tickles, doesn't it?
Cold sprays, colorful Band-Aids, and cute therapy dogs are tools in the arsenal to make these pokes less scary.
At first I was so nervous, but I knew how shots felt, so right then and there I felt fine.
The Pfizer mRNA shot is about 90% effective at preventing symptomatic infection. Those findings from a clinical trial of more than 4,000 elementary-aged children. It's a third of the dose of adults, 10 micrograms, given 3 weeks apart. Each time, a shot to the shoulder muscle.
As far as the side effects, the initial clinical trials seem to suggest that kids may actually have fewer side effects or not as severe.
What do you think are some of the challenges that lie ahead with getting that big of the population vaccinated?
I think some of the parents who are skeptical, who had bad side effects themselves, may be more skeptical about worrying about inflicting it on their kids.
Some providers are taking extra time. At Community Medical Center in Missoula, Montana, they're waiting to start kids' shots November 8th.
One of the reasons that some people aren't vaccinating this Thursday is that the doses are 21 days apart. And if you were to give a vaccine on Thursday, then it would mean that the second dose would have to be on Thanksgiving, and most people are either out of town or with family, and a lot of our healthcare workers are off.
So for this group of children that has gotten their first dose of this Pfizer vaccine on Wednesday, you do the math, 21 days later, that puts you at the day before Thanksgiving, Wednesday, November 24th. We know from the science that you get fully protected about 2 weeks after that second dose of vaccine. What does that mean? Well, you are talking full protection for this early group of kids getting this shot well before the Christmas holiday. Lindsay Thies, Newsy, San Francisco.